So I think it is very clear that this drug needs to be used carefully and that alprazolam has three main drug interactions. So it is advised to avoid using it with strong CYP3A4 inhibitors. So this is like ketoconazole and itraconazole. And we talked a little bit about those inhibitors earlier. So they can increase the levels of alprazolam and lead to unwanted sedative effects. Um, Caution should also be taken with other CNS depressants, central nervous system depressants, as they can amplify the sedative and respiratory depressive effects that alprazolam has. And lastly, some anticonvulsants can decrease the effectiveness of alprazolam by inducing those CYP3A4 enzymes, which will ultimately lead to lower plasma levels. In the case of an overdose, immediate medical attention is crucial to prevent life threatening complications. Moving on to section 3, here are some of the side effects and precautions about Alprazolam. Both patients and healthcare providers need to be on the lookout for the common side effects that come with Xanax. So, on the left side of the screen, you can see a list of the side effects for Xanax bars. This is taken from a addiction center's website. Um, so the ones that I want to highlight are drowsiness and fatigue. So alprazolam can cause this and affect the ability to concentrate or perform tasks that require mental alertness, which makes sense because this is kind of just calming the CNS. There's also some gastrointestinal issues that can ensue. So, changes in appetite, nausea, vomiting. These are all common side effects experienced by some individuals that take the drug. And then cognitive impairment. Some users can experience memory loss, confusion, or difficulty thinking clearly while on alprazolam. I might argue that this slide is the most interesting in the PowerPoint, mostly because of the paradoxical reactions that alprazolam can exhibit. So we know that it works by calming brain activity and reducing and treating anxiety, but for some people, it can actually have the opposite effect. Paradoxical reactions are uncommon, but they're important to be aware of. So it's basically when a person's reaction is the opposite of what you expect from alprazolam. So instead of feeling calmer, you might actually feel more anxious, restless, or even agitated, and it can be quite a scary experience. So some signs that you might be having a paradoxical reaction are you have increased anxiety, you're restless, agitated, talking more than usual, irritable, maybe some insomnia or hyperactive. So, if you experience this, it's important to talk to your doctor as soon as possible so they can help figure out what's going on and what to do next. Um, but don't take more alprazolam thinking that it will help because this can make things significantly worse. Also, allergic reactions to this drug are rare, but they can manifest as a rash, itching, swelling, or difficulty breathing. There's a picture of someone who had a reaction to alprazolam on the screen. And also, there's a risk for psychological dependence, which we've talked about extensively in this PowerPoint. But the prolonged use of the drug can lead to dependence, making it difficult to stop the medication for some people.